Thank you for joining us. My name's Adam Latto. I'm the CEO of the Western Sydney Leadership Dialogue, and I'll be a facilitator today. To start, I'd like to acknowledge the traditional custodians of the lands in which we meet today, the Darug people, and pay my respects to Indigenous elders past, present and emerging. It's a pleasure to be here today to facilitate the Western Sydney Health Forum, their annual public meeting. As mentioned, my name's Adam. I'm the CEO of the Dialogue. Background to the Dialogue, we first started in 2015 as a way to shine the light on the key issues in Western Sydney. It's probably none more important than the health of the residents and the communities in the region. Through the power of connecting the right people, we shape, progress and affect positive social and economic change for a thriving and growing Western Sydney. It is indeed a pleasure to be here today to facilitate this session on such an important conversation for one of the most important organisations in Western Sydney, the Western Sydney Local Health District, an organisation which looks after the current and future needs of the communities of Western Sydney. To commence, I'd like to invite Graham Loy, the Chief Executive of Western Sydney Local Health District, to the stage.
Hey, thanks Adam, and thanks everyone for joining in and participating today. So thank you to the panellists for joining into the discussion and helping us out. Can I also commence by acknowledging the traditional owners of the lands on which we meet? We are on the lands of the Barromatic people of the Darug Nation, and pay my respects to elders past, present and emerging, and everyone who's with us here today. Is, was and always will be Aboriginal lands, and we have a really big community and a strong commitment and desire as Western Sydney to have a really strong partnership and work with our Aboriginal communities and our staff to make sure we close the gap, to make sure we improve lives and to make sure that we make the experience of dealing with our healthcare services a positive and successful relationship. Been a really big year this year for us. Very exciting opportunity to sit up and talk about some of the things that have worked, and hopefully you'll hear some fantastic opportunities and fantastic results out of the day. No more than some of the key strengths and key partnerships. So can I thank Adam for coming along and helping us out today? Really important, a good partner for us in Western Sydney, a strong advocate for the communities, and a great way for us to help us get our message out around what do we need and how can we help, and some of the fantastic things that occur in our catchment. Some really exciting things that have occurred. Our services have performed really, really well, and I'm enormously proud of the hard work that goes in to all of the service delivery and the staff that we've got. And nothing happens without our amazing staff. So they're a huge part of who we are. They're an amazing part of what we do. And the care that I see that gets provided to our community on a daily basis is just phenomenal. People come to work for the right reasons. They come here to help each other. They come to help patients, and they come to make people's lives better, and they achieve that every day. It's such an amazing workforce. Nearly 17,000 people work for us across the spectrum of everything that we do, and it's just an amazing opportunity to work with our community. Our community is about 1 million, just a little bit over 1 million people actually. Really, really diverse community. We have a really strong multicultural aspect, which is part of the richness of who we are in Western Sydney. When we think about, what is our identity and how do we link in with the community, what really pleases me is how well our workforce is represented with that community. If I look at who's walking down the corridors of our hospitals at Westmead or Auburn, or Mount Druitt, or even in our community health centres, our staff are very representative of the community, and that's a really strong component of what we do. We've preferentially tried to recruit out of our local communities, which makes such a big difference for engagement and connectivity and relationships, so that's really important. And we've been able to achieve that in spades in a lot of areas. That's been a fantastic outcome. Can I also thank the executive? It's a tough gig at times, and times can be tough, and there's lots of challenges that we face. But when you think about what does leadership look like, it's about teamwork. It's about how do you get the right people around the table, and how do you create an environment where everybody leans in together. It's a bit like the cabinet approach. Everyone's an expert in what they do, and they're experts in their fields. But when we come together as a team, both at a facility level and a district level, you see that cohesiveness, you see that cooperation, and you see that collective problem solving around how we lead, and it is a really, really strong group. So it's a privilege for me to work with that team and to be part of it, and I think the district is really lucky to have everyone involved. Equally, we have a fantastic board, and I'll hand over to the board chair, Loretta Demento, in a minute. It's a really strong part of our partnership around how do we make sure our governance and our direction is right and where we go. So when I think about what we've been able to achieve through the year, the services that we've grown, the investment in staffing, the huge increase in nursing staff that we've got, the ability to grow and invest in the precinct, and the ability to think differently, how we capitalise on some of these fabulous investments that the New South Wales Government has made in Rouse Hill Hospital and in Blacktown and Mount Druitt to create additional beds. Some of the work that we've done that really is highlighted through our work in InTouch and in the integrated community health space. You know, it is a phenomenal effort for the year, and we've achieved an awful lot in that 12 months. So rather than rabbit on all afternoon, which I could do, I will ask Laura Demento to come up and talk to you. And she's the board chair. She's a new board chair for us, long-term member of our board, but new in the role of chair, and a fantastic partner for us as a district and for me as a chief executive. So thanks very much.
Thanks very much, Graham. As you heard, my name is Loretta Demento and I'm Board Chair for Western Sydney Local Health District, and it's a great pleasure to be with you here today. I'd also like to start by acknowledging the traditional owners of the land in which we meet, the Darug people, pay respects to their elders past, present, emerging, and any of you joining us today. We have an exciting discussion planned with our various clinicians and staff today, and our focus is on sustainability and innovation in healthcare. And there's no better place than Western Sydney to be having that discussion. I don't need to tell many of you that are joining us today that Western Sydney is an exciting, dynamic and vibrant area. Diversity is in our DNA. We have a population, as you heard, of around about 1 million people, and that's dominated by a young population and highly skilled workers. And with every new survey and every new data collection point, we see that that skill level continues to increase. So that altogether makes this place a hub of innovation, a hub of ideas and new thinking. So sustainability and innovation are at the forefront of our discussions. As a health district, it is really up to us to ensure that the 1 million people that call this place home live well, stay well and manage their health well. And that we have a particular focus on how we do that with the Aboriginal and Torres Strait Islander communities and with our various multicultural populations. We wouldn't be able to do any of it, as you heard, without our brilliant workforce. They are the anchor to all that we do, and Graham has mentioned it, and I want to make sure that I pay tribute to our teams as well. Their work is exceptional, it is committed, it continues every day in so many locations, in hospitals, in community and elsewhere, and it's always focused on the experience of the patient. In all the interactions we have, that just shines through, and I want to personally thank them for all of that work and their continued hard work. Our board has been monitoring all the achievements, and you've heard Graham mention a few of them. Our executive, together with our entire workforce, has really put in a significant effort for this year, and that is on the back of a couple of very, very busy years. So it's indeed outstanding work all round. And to give you a sense of our finances, for the 12 months to 30 June 23 this year, the district spent $2.4 billion on total expenditure. The majority of that related to our staff expenses, and that was around $1.5 billion. We also raised around $290 million of revenue, and all of that together saw us perform within 1% of our budget. But today won't just be about numbers. We're going to move on to our panel discussion. And before I go, I would like to again thank the executive, the workforce, and for today particularly those that have made today a possibility, and to the panellists that are here and devoting their time, thank you. And to Adam, we've heard you're a great advocate for Western Sydney, so thank you for being here with us, and over to you.
Thanks, Loretta, and couldn't do it without partners like Western Sydney Local Health District. Thank you. As you've heard, today is an opportunity to reflect on the year that's passed, but also look about what the future needs might be as well. If you're watching via live stream, please use the QR code, which was emailed to you, to ask questions via Slido, and we will get to them a little bit later. I should say up front that for those whose questions aren't answered today, there are probably a few to get through. I've only got a limited amount of time. The staff here at the Health District will take them on board and make sure that they're directed to the right appropriate person, and you will get a response. So if you're logging in via slido.com, looking for the number, it is 7220641. We're keen to take your questions and engage. As Loretta and Graham touched on, the theme for today is innovation and sustainability. However, you can ask questions relating to the annual report, anything else that's happening in financial reporting, which can be found via the link on the WSLHD website. I would like to introduce our panellists. With me today is Dr. Chan Yuan, who's a staff specialist paediatrician, Dr. Gina Rue, diabetes and endocrinology staff specialist, Chelsea Hall, the advanced musculoskeletal physiotherapist, it's a mouthful, Aaron De Los Santos, emergency department clinical nurse consultant, much easier title, mate, thank you. I'll start with Dr. Chan Yuan, staff specialist paediatrician, to give a bit of background and to her work and what she's doing in the district. She's a dedicated general paediatrician with a strong commitment to healthcare and medical leadership. Currently working at Blacktown and Mount Druitt hospitals. Her journey in paediatrics began with training at the Children's Hospital at Westmead. This resulted in securing a fellow and subsequent staff specialist role at Blacktown and Mount Druitt hospitals. Throughout her career, Dr. Yuan has been deeply engaged in teaching quality improvement and fostering medical leadership. She has actively participated in initiatives like FLASH, organised GenPed conference, and contributed to CEC Neonatal Sepsis Working Group. Dr. Yuan finds most rewarding in her role is the relationship she builds with patients, families, and the broader Western Sydney community. Collaborating with a motivated multidisciplinary team, she consistently seeks excellence in patient care and continually reevaluates her role in the patient's healthcare journey. Driven by the desire to improve prognostic outcomes, support children with developmental challenges, and aid families facing complex health issues, she remains deeply inspired in her work. For Dr. Yuan, the main motivation behind her commitment is the exceptional team she works with, the patients and families she serves, and the limitless potential for positive change and improvement that she can contribute to the next generation of healthcare. Very impressive credentials, and welcome, Dr. Yuan. Dr. Gina Rue, diabetes and endocrinology staff specialist. Gina is a staff specialist endocrinologist at Westmead Hospital, where she co-leads the diabetes and thyroid in pregnancy service and assists in development, implementation and evaluation of new models of care for the service. She's an avid early career researcher with a particular focus on diabetes in pregnancy and the longer term implication of COVID-19 on diabetes in pregnancy and the general population, and has a strong interest in medical education, helping to form the Early Careers Network of the Australian Diabetes Society and being involved in the curriculum development for the Master of Medicine at the University of Sydney. Welcome. Aaron De Los Santos, Emergency Department Clinical Nurse Consultant. Aaron is a highly accomplished healthcare professional with a diverse career. Beginning his nursing journey as a new graduate nurse at Westmead Hospital in the hospital in the home department and orthopaedic and trauma ward, Aaron has ventured into several nursing positions that have allowed him to excel in his career. This includes roles like the Emergency Department Clinical Nurse Educator, Blacktown Mount Druitt Hospital Surgical Stream, Medical Stream Educator, and COVID-19 Nurse Manager at ECAT Clinical Nurse Consultant. More recently, Aaron has been overseeing staff progression and education, policy, procedure and model of care development, research and clinical leadership in his role as Emergency Department Clinical Nurse Consultant. In each of these roles, Aaron has been driven by the enjoyment he experiences from every day in the emergency department, not looking the same, and the close collaboration with a multidisciplinary team, management and executive. Aaron also favours the constant opportunity to innovate and adapt in response to the evolving healthcare environment. And Chelsea, I've forgotten your bio here, but do you want to tell us a little bit about yourself?
Yeah, sure. So my name's Chelsea. I'm an advanced musculoskeletal physiotherapist. I work in the emergency department here at Western Sydney, especially Westmead. I'm very fortunate to have been a part of the Western Sydney Local Health District now since 2021, right behind COVID pandemic. I was very fortunate enough to be employed in a role directly impacted by COVID-19, the RAID model of care, which was very interesting, which I might speak to a little bit later on. My background, so I've been a physiotherapist for about 8 years now. I've worked here in the public health system for about 5 years. I've worked overseas for the NHS, and I've worked in the private sector as well, actually as a new grad. So I feel like I've had a interesting journey into healthcare, but found my way back to public health land eventually. And I have a big passion for trying to progress the physiotherapy scope of practice, and I have a really big interest in emergency medicine especially, but also fostering leadership across healthcare.
It's an impressive journey, Chelsea. Thank you, and apologies again, I picked up the wrong notes on the way out the door, so that's a great background and a great journey so far. So look forward to hearing more about it. We heard earlier that the theme today is sustainable innovation and what that looks like from a healthcare system perspective. I might get you to just start with you, Chelsea. What does a sustainable and innovation-focused healthcare system look like to you?
Sustainability and innovation are two big words that get thrown around, I think, in health. But I think what it means is to deliver really high-quality care that is equitable, it's affordable, and achievable without losing or impacting, I guess, the environment. Now, there's different ways in which that can look. I think sustainability can be seen with preventative medicine. I think it can be about creating sustainable pathways in healthcare, and I think it can be looking at reducing the carbon footprint across healthcare as well.
Thanks for that, Chelsea. I think those are some very profound thoughts, and I'd have to agree with a lot of those. I think sustainability and innovation in healthcare is. You're right, those words get thrown around a lot. For me as an early career paediatrician, thinking about these two ideas, it's really about the way modern technologies and tools can be used to complement and optimise our patient-centred care approach, and how we can efficiently deliver high-quality healthcare. Having worked in Western Sydney in sort of the paediatric sort of space, we've already seen lots of changes in the last few years, including the opening of a new ward, development of connected care clinics, and expansion of our community developmental specialty teams, and a strong ambulatory care team. And so we're sort of looking at these models of care in terms of innovating the way we deliver healthcare to our children. And I think the path forward for us in paediatrics in thinking about innovation and sustainability is to develop a sustainable workforce, sustainable structures and frameworks in which we work, and ask ourselves the questions frequently: how can we, what are we doing currently, what are we doing well, how can we do better, how can we improve things, how can we be more efficient, be more cost effective, reduce our global impact, our environmental burden, and have these frameworks continue to be adaptable to the changing global society and rapidly progressing, advancing technologies. It's an exciting time to be in health, I think, and to sort of think about these quite seriously.
Yeah.
Thanks, John. I think I echo the thoughts of Chelsea and Chan. I also agree that, unfortunately, sustainability and innovation, they're both quite nebulous terms. However, I do think it's something that it's a hot topic, because we know that at the way we're going, we are not really achieving sustainable healthcare. We know that the population is growing, the use of hospital services is growing, the use of healthcare outside of hospital services is growing. So I think it's about developing and fostering new technologies, new strategies, new research in order to address this. And this is not just about patient care. It's obviously about patient care, but also about environmental impacts, because we're not going to be here in the not too distant future if we don't think about that as well. We have to make sure that we're implementing this, however, in a way that doesn't negatively impact patient care, and in fact should actually improve patient care when we're implementing these strategies. and John already mentioned this as well, but I think an important part of that is ensuring that we're evaluating everything that we're doing on an ongoing basis and trying to figure out ways where we are lacking and trying to address specific ways we can address that. My main areas in diabetes and endocrinology, particularly in diabetes and pregnancy, which we know is a growing number of women, especially in our community where we have a large number of women in the reproductive age. The proportion of women who are developing gestational diabetes in particular is growing. So the current workforce is not going to be able to sustain that in the long term, and we need strategies outside of what we're doing at the moment. So that's what I think it involves.
Great point.
That's perfect, thank you. I suppose firstly thank you all for inviting us to be panellists. It's not often we get to share our insights at a forum like this, so thank you all. When I think of sustainability and innovation, I think of the way forward, and in preparation for FLASH, which is a piece of innovation in itself. I was doing a bit of reading, and I think one of the things that really stuck with me is the work we do on innovation not only needs to positively impact the current generation, but can't equally negatively compromise the future generation. And so when I think of the way forward in terms of sustainability, what better way to facilitate that than to have frontline clinicians driving or leading organisational change, providing them with the resources and access to clinical researchers and implementation scientists.
I want to pick up on, Chelsea, your initial point around the word sustainability and innovation, because like you said, they are words that are often thrown around quite easily. But from what you're seeing at the ground level, in the practical sense, do you think that the Health District is heading in the right direction in that space?
Yeah, I do. I think that Western Sydney and Allied Health in particular is in a very unusual, unique position at the moment in which we've shown, I think especially after the COVID pandemic, how resilient and how adaptable the workforce is. Allied Health was used, I guess, in those years in spaces that weren't traditionally considered within our scope. So examples of that was a multidisciplinary team within the emergency department called RAID ED. Now, it was a district MDT that was implemented during COVID to try and facilitate early and quick discharge of complex and chronic disease straight from the emergency department to try and reduce health burden. Now, the success of that through the pilot program, it really embedded that into practice. So that is something now that is within the district permanently, and so successful that other health districts across New South Wales have actually implemented their own version of the same. Mm-hmm. So Hunter New England especially, and I think Bankstown Hospital as well, which is a really amazing thing to see that Western Sydney's kind of started that drive.
Mm-hmm. It's great that Western Sydney's leading the way.
Yeah,
we love that.
I think so.
Gina, I might direct this one to you. What role do you think emerging technologies can play in enhancing healthcare sustainability?
Yeah, I think, as I alluded to before, I think emerging technologies are essentially something that needs to be embraced, and we need to consider very carefully, however, while doing this, in order to ensure sustainability of our healthcare system. So I guess one of the issues is that we have been strong-handled almost in terms of the models of care that we can use because of the limitations in resources, for example. And use of emerging technologies is certainly a way that we can try to reduce this burden on the limited resources. So, for example, in the diabetes and pregnancies space, because it's a large group of women that's growing every year in terms of the population size. I mentioned before that we need to adapt our delivery of the healthcare system in order to meet the demands. One way of doing that is considering the risk stratification process. Recognizing that patients are not a homogenous cohort. We're a heterogeneous group of people because of the fact that the population is so diverse. And therefore, we need to direct resources in an efficient manner as well as in a cost-efficient manner that is also environmentally meaningful. So one way of doing that is, Chelsea, you mentioned the developments that happened through COVID, and I think COVID really taught us the vital role that virtual care plays in our healthcare system. But in the pregnancy space, it is important that we recognise that a lot of the women do need to be reviewed face to face, obviously, but we do want to try to limit the burden on the women as well as the healthcare system by recognising the low risk population who can be reviewed more remotely, and therefore the digital health team here have been very helpful to us in helping us to find ways around that in terms of app-based systems and risk stratification approaches. So I think these are very important emerging technologies that we need to consider. The others are things that are probably a little bit further away. So obviously wearable technologies are becoming more and more commonplace. At the moment, most of them are not in a sphere where we can reliably use them in the healthcare system. However, that being said, that can change, and when that happens, we need to be prepared to be able to incorporate that in our healthcare. In diabetes, we already have an element of that already with continuous glucose monitoring, so we've adapted in order to bring this into routine clinical practice, and I think this will be the case all over healthcare. Just briefly as well, technologies are also very important for reducing waste as well as improving both energy efficiency and general workforce efficiency. So, for example, digitalising healthcare service delivery, digitalising acts where it can be performed in batches, for example, or in bulk, in order to reduce the burden on the workforce, but also on the environmental impacts.
You mentioned quite a number of the positive implications of technologies. On the other side, what are some of the ethical considerations, and I'll open it up to all of you, what are some of the ethical considerations that need to be factored in when looking at some of these new technologies?
So I might just
I'll start with you. Yeah.
So I think one very valid concern is data and privacy, which is something that is in the forefront of our news cycle these days, and that's definitely something where we need to work with security systems in order to make sure it's protected for all both staff and patients. The other major thing, I think, is something that Chelsea mentioned before, which is the fact that these technologies are not currently accessible to everyone, and equity is definitely a concern, especially in our local health district.
Aaron? Oh, yeah.
Yeah, absolutely. So ethical considerations of security and privacy and obviously consent, and also what do we do with all the data that we've now got, where do we store it? And I suppose the way that we can address it really is to have a really robust governance structure around keeping an eye on and notification of incidences and management of them. But equally, really strong collaboration and liaison with our e-health experts and digital health solutions teams.
John?
Yeah, it's a really good question, and I guess there are unique ethical considerations in the paediatric population that I sort of look after as well, compared to the adult population. This is more the clinician in me, but when I think about ethical considerations, I think about the 4 clinical ethics, the ethics of autonomy and the ethics of beneficence, of non-beneficence, and justice, which is also equity. And so when you sort of look at these pillars of ethics through a paediatric lens, there's some real challenges with thinking about autonomy and the patient's autonomy, particularly in a child who often isn't able to advocate for themselves. And then how do you balance that with some of the challenges with managing sort of parental expectations and parental interests and third-party interests? So there's a real ethical dilemma there of what we do with all this data and all this information, and how we sort of move forward with our technologies in terms of patient autonomy and the child's rights. And for us in Western Sydney, looking after families and children, we do have a very diverse population, very multicultural. I think it's a real strong asset to our community, but we also have populations that have socioeconomic disadvantage. There's lots of neurodiversity. I've got lots of families with learning difficulties and geographical challenges. And then how can we deliver technology and changes in healthcare delivery that meets the needs of these populations, that they're not being disadvantaged, so that we're not biasing our delivery towards a particular more advantaged population, and how can we sort of tailor it to the needs that these consumers need. I think that's a real challenge for us to sort of look at in the future, and it's an exciting challenge to have, I think, because as I mentioned earlier, we are sort of moving so rapidly forward in advancing technologies, and there's so many options nowadays, and to sort of consider how they fit into our models of care with a strong ethical standard behind it and strong governance behind it is an exciting thing to think about.
Absolutely. Chelsea?
Yeah, I think the points about health literacy and digital literacy is definitely a valuable thing to think about. I think the other thing to consider is trust in the patient-doctor or the patient-healthcare provider, I should say, relationship. I guess in the community there might be a mistrust of the way that technology may be used in the future, and I think finding a way to communicate the benefits and the successes of utilising technology to actually harness the fact that empathy is something that's lost in healthcare due to things like administration tasks. So if those sorts of things can be used or improved by technology, it will only value both the staff and the patient experience.
Yeah, couldn't agree more. Aaron, we heard from Graham earlier that the roles of hospital in the home are expanding. And on the theme of technology, what ways can telemedicine and remote monitoring contribute to a more sustainable healthcare system?
So I was actually really privileged to work with a hospital in the home over a decade ago. It was actually called post-acute community care back then. And absolutely they've expanded their service, and partially due to the use of technology. And the example I can think of is I used to drive to patients' homes every day to change their intravenous infuser bottle. And from what I understand now, they've used virtual care and telemedicine to empower a certain subset of their patients to change their own infuser bottles with virtual support. So essentially what you see then is you reduce running costs, so you get that financial sustainability, you get a reduced environmental impact, so then you get environmental sustainability, but equally you get an expansion of the service, which is really what our district needs currently. So here you've got a really nice model to move patients through the system. And on the flip of that, I did a bit of work with the ACI around nurse-initiated care in the emergency department. And in networking with our rural and remote colleagues, they've got a really nice virtual system that they use. And they use things like virtual triage and a virtual waiting room, and can dial into big metro hospitals for support. So essentially they've got a system that will bring patients into the system. So what we have essentially is almost a 360 model where we can stream patients in and then stream patients out via telemedicine and virtual care.
Yeah, wow, impressive stuff. Chan, I might throw to you. I mean, looking at even whether it's telehealth or whether it's in-person care, balancing the need for innovation while also understanding the ethical considerations of patient care. Talk us through that a little bit.
Yeah, look, it's a really interesting thing to think about. I think the human experience, the experience the patient has, is really important, and I think sometimes the patient or a consumer or a customer, even if you go down to the coffee shop, you leave with a feeling, even if you don't remember exactly what's happened in that consultation, but you leave with feeling, and it's nice to sort of have patients leave with a positive feeling. And I think that human touch and that human experience is incredibly invaluable. Even despite all sort of our advancing technologies, I think having that at the centre of patient care is still going to be a key way in which we deliver healthcare. And I think there are some challenges in balancing this with sustainability and innovation. And during the COVID-19 pandemic, I'm sorry to bring it up again, it sort of really highlighted that to me as a clinician working with children, and I think the adult experience might be a bit different, but I see a lot of children requiring neurodevelopmental assessments, and sometimes these diagnoses can be quite complex to make, and it can be quite life-changing for a family. And all of a sudden in the pandemic, we've had families needing to shift gear suddenly to a virtual platform, and that sort of came with its own challenges in terms of technology and access, and also made it in some ways more difficult for us to provide an accurate clinical diagnosis, because all of a sudden you've lost that face-to-face human interaction, you've lost the opportunity for observation and for interaction with the child in sort of a clinical setting, and that all forms part of our diagnostic impression. And instead, I've got families behind a screen trying to deal with the internet, trying to deal with the visual and the audio. Meanwhile, the child's off the screen, running around, playing with their siblings, and the patient's trying to wrangle the parents trying to wrangle them back into frame so that we can sort of make those observations and make a fair and accurate diagnosis. So I think there are some challenges with how we use technology. But on the flip side, there are certainly settings in which it works really well, particularly for our remote populations or our populations with transport or geographical challenges, with other sort of families with lots of children with other competing responsibilities. A virtual sort of more technologically advanced platform can be quite helpful. And so how can we balance that human need and that human interaction experience with our technologies? It really is quite challenging in paediatrics, and I think to try and move us forward, you need robust research and education into some of these technologies. We need to sort of think about the consumer and collaboration. Who are we implementing these changes for, and is it something they need? Is it something that will work for them? I think there's this concept of personalised medicine and precision medicine moving into the future, and I wonder if there's room for sort of personalised technologies, because one technology may not work for one particular subgroup of the population that we sort of manage. So consumer collaboration, I think, is really important in terms of some of the considerations in innovating the way we deliver healthcare, lots of feedback and evaluating our effectiveness throughout the whole process.
Yeah, I think approaching it as if not a one-size-fits-all approach is probably a smart way of doing it, because there is a need, I'm hearing, to be adaptive, to be responsive to localised and personalised situations. Chelsea, I want to throw to you. You mentioned a couple of words earlier around equity and fairness, which I think are pretty important ones, especially when dealing with the communities and residents in Western Sydney. We're well aware of the disparities within an LHD like Western Sydney, which has its unique issues based on socio-demographics. What are some of the innovative approaches that are being taken to address some of the equitable issues when it comes to access to services in health services in Western Sydney?
Yeah, I think there's been some excellent initiatives from not only our physiotherapy department, but I guess allied health as a whole. I think, for example, we have access to Aboriginal liaison officers on call to help the population group meet outside the hospital. We know that there's a lot of fear around accessing health services, so to have that type of interaction to try and reduce that fear, then to move through the hospital system, I think is really valuable and a big opportunity of growth in the future. I think that from a physiotherapy perspective, doing the simple things well, like having the Chartered Healthcare of Human Rights posted on our walls, but having them be LGBTQIA plus, I guess, approved, to make sure that it is actually equitable and fair for all. I know recently there was a refugee tour of women through the hospital who, with all sorts of different interpreters and support workers, to move these women through different parts of our hospital that they may need to utilise at a later date. And I think, isn't that fantastic? And the response is quite positive, to try and reduce some of the fear, which I think is a barrier to accessing healthcare. I know that the interpreter usage in the last financial year was 44,000 incidences of care, which is incredible.
It's massive.
And I think in terms of the last 2 financial years, that was an increase in 10%. So I think having clinicians really be on board with the need to actually connect with patients on a level in which they can understand, to take out that barrier of language and health literacy, I think is really important. But I think they're definitely, there's always more that we can do. There's always more that we can move this in the right direction.
Yeah, it does point back to your earlier message around trust being at the forefront of that delivery. Dr. Rue, off topic a little bit, what can healthcare facilities do to reduce their environmental impact through sustainable practices and green technologies?
Yeah, it's a tricky question, because it's something that I think local health districts have been trying to work through for many years, and every local health district approaches things slightly differently, I think. I believe that we should be approaching this both from an individual level, so we all have a part to play, but a lot of it does have to be from a systems-based level where in order to reduce waste, to improve energy efficiency, and to limit the climate footprint that we're leaving through our healthcare practice. I guess one thing that has been brought up a few times is virtual care and telehealth, and I'd just like to bring that up again for this question, just because you've already mentioned how you were driving around years ago from house to house. Just imagining the carbon footprint from that versus virtually managing some of these patients, and Chan already mentioned that obviously this has to be carefully chosen in terms of the patient population we're aiming this for, because we obviously don't want to compromise patient care in order to deliver virtual care services. Even from outpatient occasions of service perspective, for example, the women we see in diabetes and pregnancy clinics, these women are seeing us every 1 to 2 weeks, so that's a lot of visitor transport, a lot of patient transport, and that all adds up to many, many tons of greenhouse gas emissions. So it's just something that we have to consider and make sure that we have the systems in place in order to reduce, and by offering and facilitating virtual care when it's appropriate. I guess another thing is that that each inpatient day of stay is a huge contributor to both energy use, water consumption, waste production, and we need to find ways to reduce that as well, both from patient care perspective, so making sure that we have beds available for the patients who need it, as well as from a financial sustainability and economic sustainability, financial sustainability and environmental sustainability perspective. And I think virtual care actually plays a role in this as well, because it allows us to do early discharges in a safe manner. Risk stratification systems will allow us to choose the right population with a safeguard. So I think all of that contributes to reducing our waste production and our energy consumption. Thirdly, there are some obvious things that I'm sure everyone in the audience would be aware of, that we unfortunately do use quite a lot of single-use consumables, and all of that needs to be reduced, and I think we are in the process of at least improving our single-use consumable use, especially plastics, but other items as well. And then there are obviously things like perioperative in particular, anesthetic use, which has significant volatile gas use, as well as this is something that I have to admit all clinicians I think are guilty of, where there is duplicate care. So things are done twice, things are done 3 times, and that also obviously leads to waste as well as inconvenience and sometimes harm for the patients. And some of that also requires coordination of care as well that could be improved. And things like unnecessary testing, unnecessary diagnostics, all of those things add to waste, unfortunately, and it's something that we each as individuals have to take into account, as well as the departments and hospitals as a whole. And then in terms of systems, the local health district has already made lots of progress in terms of lighting efficiency, as well as renewable energy. So those are things that need ongoing evaluation and optimization, because as technology changes, our targets should change as well in terms of energy efficiency and waste production.
Did you want to add anything to that, John? No, it's fine. Okay, great. On the theme of innovations and technology, you probably can't have a conversation without mentioning AI. There's a lot of discussion about that at the moment. When it comes to AI and healthcare and the potential opportunities and risks to this sort of innovation, I'd like to call on, I think we've got some of the executive here for the LHD, and Christina Augusto, to maybe talk us through AI and some of the opportunities and risks that it might pose.
Thank you, Adam. Good afternoon, everyone. I'm Christina Augusto. I'm the Chief Digital Health Officer, CIO Western Sydney. So AI is a great opportunity for us to use in healthcare if we do it safe and secure. To mention a couple of different areas where we can use AI is in medical imaging, of course, which has been happening for such a long time already in supporting the radiologists to interpret images, X-rays and CTs and MRI. It's also an opportunity for us to use predictive analytics to use the vast of data that we have in our operations to do service planning, operational efficiencies, find that through bed management, resource allocation, and those kind of things. It can be used as, a virtual assistants. I'm sure you have heard about ChatGPT, a generative AI that we can use. We can build bots on top of just as simple as clinical guidelines to ask questions to a vast of information that we have safely and secure already in our environments, but it can also be used then more to ask research questions, answer research questions. We can use it in our EMR system. We're already doing that for discovering early risks of sepsis using the data that we can use in ED. So there's a vast of different, there's a vast of different opportunities that we can use if we implement it safe and secure. Another thing that's probably should mention is, using natural language processing, which is part of AI, and is also then also used in generative AI to unstructured data that exists within our EMR to create the more structured data sets from all the clinical notes that we provide every day for our patients and our staff.
Thanks, Christina. That was great. I think there's definitely some opportunities there worth exploring down the track. To answer the next questions, one might be for Graham. How can healthcare organisations promote a culture of innovation among their staff and stakeholders?
Oh yeah, really good question. Having an ecosystem of innovation is more than just getting the right environment for it. It's actually around, you have to make some deliberate decisions and put some deliberate structures in place to make that happen, and create an environment where it's okay for people to think outside the square and to not just be in the mainstream of decision making and diagnostics all the time. So you have to have, first of all, you have to have a strategy. What does innovation mean to you, and how do you create that, and how does that work in your environment? Then you need to make sure that you create the space for people to spend time in that innovation strategy, and give them the time to think about what they do. And then there are opportunities at small scale and large scale. So when I think about what we're doing out at Rouse Hill and design for the new hospital out there, it is very deliberate strategy around innovation and how we can think very, very differently around what does healthcare of the future look like. So I think at large scale in capital you can do it. I think at small scale in day-to-day operations you can do it. And I think we've been doing it for decades, and we used to call it clinical redesign. And that is, I guess, the genesis for what innovation looks like for us moving forwards, around how do we take those really good ideas or create opportunities for people to come up with those really good ideas, and then change the way that we provide care and improve care and experience for patients.
Thanks, Graham. I might ask you to stay there, because I think we've got a few Slido questions to finish up with, and thank you.
They'll be all the tough ones. Yeah,
some really tough ones here, mate. I'm going to get through as many as I can, knowing that we've only got sort of 10, 15 minutes left. Graham, I might ask you, there's a lot of talk today around innovation, technology, and in a region where perhaps access to digital services and literacy levels might not be the same as they are in other parts of Sydney, how do you ensure healthcare service and models of care still apply to those that may not have that same sort of digital connectivity?
Yeah, look, I mean, that's a really important component of when you think about the breadth of your community, how do you reach everyone? And I guess the starting point is not one model fits everyone. So I think we actually have to have that flexibility around how can we do it differently and target the services we have to the different communities that we serve. So yeah, there are some communities that struggle to get the same level of connectivity as others, whether that's access to IT or whether it's access to a network, or if it's just whatever their circumstances are. So we need the capacity to have that range of service delivery. So, technology is great, but remember, it's just a tool in providing services for us. It's not the solution. It's not replacing healthcare. It's not, we don't need to run hospitals because there's robots around running everywhere doing stuff. We'll leave that for the TVs and the movies to do. But it's about creating the environment where you have that opportunity to get to maximum space. The things like our community health centres and our primary care relationships with the GPs can really leverage that. So they may not necessarily have the devices themselves, but they certainly have, often a GP or a community health centre that's close that they can go to and get that connectivity, so we can still bring them together.
Interesting one here. Will there be any injury centres due to a large number of sporting facilities in the LGA? So,
I would say we've had injury centres forever, and I call them orthopaedics and trauma services, right? So Westmead is one of the 7 trauma centres in the state, and it has a huge amount of trauma work that's done here. We do trauma at all of our facilities. So yeah, we do injuries every day. Every ED session has people coming through who have experienced injuries. So we already do that as it stands now. We will continue to grow that around how we do it. But yeah, I think ongoing injuries and sporting injuries has been a bit of bread and butter for EDs for a very long time.
yes,
There you
indeed.
go. And we have one of our wonderful allied health experts there who
Yeah, I was
probably
gonna say,
sees
I've
more
got
than any of us.
Yes.
I was thinking I might be well placed
Yes.
to kind of speak to sporting injuries, if nothing else. I think that physio especially is in a great position to actually help with this sort of thing, with managing non-chronic conditions out in the community so that they don't actually have to access the hospital at all. I think the urgent care centres, for example, that are popping up would be a valuable addition to have someone that is well trained in primary care and also a musculoskeletal background. We know that 13% of healthcare is actually spent on musculoskeletal injuries, neck pain, back pain, arthritis, especially knee OA, osteoporosis, and that can all actually be benefited by physiotherapy service if people know where to go, how to access it, and what it's going to cost them before they reach their crisis of needing an emergency department or a hospital admission in the first place.
We are a very sporty region, so it's important to have those services.
I think you were
in there.
just reading my medical record there.
Next one here is you touched on GPs, Graham, so this is probably a follow-on. Some local GPs have introduced consultation fees recently, which would affect already struggling families. Will there be a GP-type service at hospitals? And for any of the panellists as well who want to jump in on that, feel free as well. But I'll start with you, Graham.
Look, we need to make sure that we target the services where they need to be. So I think we just mentioned urgent care services and what's happening in that space. There's a significant investment at a state level around that, and that is about relationships with primary care. It's not always critical that we employ everyone. It's much more important that we have the relationships and we get that end-to-end care from primary care all the way through to the acute services for us. So there are already 4 urgent care services within Western Sydney as part of the co-commissioning work that we've been doing. I think there's another 2 that the feds are opening up. So we have strong connectivity already with the primary care services. We've got a GP on our board, so we have a really good connectivity. So it's not about saying do we open a service or do we employ a staff member. It's about saying how do we get that connectivity to make sure patients can go where they need to go. And the urgent care services are a great opportunity for someone to maybe not show up to the emergency department, go and work and get some care provided in a different setting. But also, I would also encourage people to make sure that whilst yes, that there is a challenge for us if GPs introduce extra fees, how do you think around factoring that in around what you do? And there are still lots of GPs out there that bulk bill, and so it's about understanding your local community, but having that relationship on an ongoing basis, so you make the best value out of the time that you spend with your GPs as well.
Chan, you mentioned earlier about COVID, and I think one of the things that emerged from COVID was the importance and the need to engage with communities in a way that they understand. And I think what we saw come out of COVID was, I think, an awareness now that in order to address health needs, we actually need to understand and communicate and engage with these communities earlier before we get to that stage. So this question here talks about what models would you recommend as a way to engage on the ground with communities in Western Sydney when it comes to future models of care?
Yeah, that's a really good question. I think we have good models of care already, but there's certainly room to grow these and improve these. For example, in our paediatric space, part of our models of care is we've got a really strong ambulatory outpatient service that we're continuing to grow, and we've got place-based models where our nurses will go out and do checks on children and try to keep children well and sort of in the outpatient space without needing to then see a GP or come into emergency and sort of keep them well in that space. And our ambulatory care team and our chronic complex team sort of make really strong they've got really strong relationships with the kids' hospital, with the community health centres and the community and the child and family health nurses in these community health centres, in terms of sharing the healthcare provision for these families in sort of that kind of community-based, place-based model. So I think we do have some robust models. They do need to be evaluated and reviewed as our growing population grows and the needs of the population do change. We are sort of in the department looking at other models of care, but I think balancing that with technology and balancing that with place-based models of care and marrying sort of the two together is probably not a bad strategy moving forward. But again, as I mentioned, we need lots of consumer feedback for that. So what models of care do our community want to see? What do they need? And then how can we adapt our system to meet those needs? So I think that feedback from the consumers is actually going to drive what that future model of care looks like, and there needs to be a lot more research into sort of that aspect.
Graham, on that, post-COVID, would you say you've noticed a significant shift in the way the health district now engages with, particularly its core communities?
Oh yeah, I think we learned an awful lot out of COVID and around how communication adds an enormous amount of value to the care we provide. So I think when I look at it from a community perspective, from our In Touch model and how we work in a much broader sense, there is a lot of value that comes out of it. And yes, I think that we've built a lot of lessons into the system from In Touch when we started. So. More and more, if I think about the way that our public health and population health teams, which are really those interface groups that go out in the community really strongly and effectively, work. The one thing that COVID did was actually bring to the attention, to the focus, the amazing work that those groups do, and has shown the value to the rest of us around what that means. So I think we've learned a lot from it. I think. We engage really well. We have a really good consumer network. We have a really good volunteer network. I think the area that's got the greatest opportunity to improve is our engagement with carers, right? So carers can teach us so much around the individual journeys of our patients, and there are times when we can be better at listening to that story. But that's an area that we're working on, and I think we'll continue to grow.
Yeah. I think we've got time for one final question. I know Rouse Hill has been a big project for the government and for yourself specifically, Graham. How is mental health being supported in the new Rouse Hill development?
Rouse Hill is going to cover a huge gamut of services across the system. So yes, it will have mental health services, no doubt. It will have maternity services, it'll have theatres, it'll have ED, it'll have inpatient units. But when we embrace innovation in that space, we really wanted to think differently around what is healthcare, what should it look like, rather than what does it look like, and building another hospital from the 60s. So things like lifestyle medicine, prehab, rehab, some of those support services before people get really unwell, or pre-surgery and those sorts of things that we're really focusing on. So same with mental health. There'll be connections to the community mental health. There'll be mental health services available on site. So there is a strong connectivity with it. And it will be part of a network. Remember, we are a district, so we have a really strong and a big mental health network within our district. So it'll link in really well into that space as well.
And for those that aren't familiar, tell us the status of Rouse Hill Hospital. Where are things at the moment?
Well, I mean, we were really fortunate that in the latest election, that when the new government came in, they increased the funding from 300 million to 700 million. So that's been a big game changer for us. So it's allowed us to really think more broadly around what we're doing in that space, around what we can build. So we're madly designing at the moment, going really hard to try and bring together all the different bits of what we would normally do. So how do we think differently around provision of care means every time we come up with a model around what we're going to do, we then put it through an innovation lens. So we've actually got an innovation user group, which is a peak committee for that project, and that reviews every model that comes up, and every model has been designed around the patient journey. So if we look at a model of care, normally a typical model of care will be a text document that describes relationships, but at Rouse Hill it's actually a flow chart that describes the patient journey. And we've really thought differently around how we do that. So that's going on at pace at the moment. We're doing a lot of work around what does technology look like and how do we invest well to make the journey and the experience better. We've got a really strong focus on customer experience rather than clinical decision making, and that's important because if we're going to shift the dynamic of what healthcare looks like, it's going to shift towards what is the patient experience end to end, and so the journey starts at their front door and finishes at their front door. So they'll have virtual contact at the very beginning and at the very end. So every journey has got innovation built into it. So we're heavily in the design processes for that at the moment. We've got seen our first concepts of what the building might look like from the architects, which is really exciting. We've even tried to be innovative in the way that we are building it, so it's not just your standard square and you get in there and you get lost into a hospital and try and navigate your way through corridors. So end to end, we're really trying to rethink what that looks like and how to build it better.
It's an amazing project, and can't wait to see it pop out of the ground over the coming years, Graham.
Yeah, it's going to be very exciting.
We're out of time. I do want to thank our panellists firstly, amazing bunch, and I think the health and well-being and care of the communities of Western Sydney are in safe hands with you guys at the helm. Thank you very much for your time today and for your input. Thank you to Graham and Loretta for sharing and being honest and as candid as you can be on some of these issues. I know they're not always easy, but you've spoken forthrightly, and I think there's a lot to be excited about when it comes to the care of Western Sydney, care of communities in Western Sydney. Also want to acknowledge the work of the corporate comms team in putting it together, this initiative. It's important that the voices and the people of the region have an opportunity to share and engage with the Health District, and you guys are leading on that front. So thank you for your time. On behalf of the Health District and myself, thank you for your time today, and we'll see you all shortly. Thank you.
Hey guys, Billy Dibb here, also known as Billy the Kid Dibb. I'm at Westmead Hospital going through this chemo cycle. This is round two of my treatment. It's been quite an experience to say the least. I'd like to thank the nurses and the doctors for going above and beyond, and I'm forever grateful for your love and support.
I've just received a fantastic care. Professional care from the staff, not even with the nurses, but also with the kitchen staff and with the even the cleaners of the hospital. They're all just beautiful people. In the 11 months of stay here in the hospital, I managed to feel like in a home away from home.
It looks like the set of a sci-fi film.
It's funny when people ask me, what do I do and where do I work? It's sort of, well, wait for the story, because I work in the New South Wales Biocontainment Centre.
Place a mask on your face. This facility is the first of its kind in Australia.
This room at Westmead Hospital reveals the future of skin cancer detection.
This technology is just amazing.
The device is armed with 92 digital cameras. In just one flash, the software builds a high-resolution avatar of the patient, documenting all the lesions on the body.
With the new device, in just one photo, only a single photo, we have the whole body. We're not missing any part.
It was one of the toughest battles of Emma Britton's life, but her journey with postnatal depression will transform the way other mothers are treated in Western Sydney, helping to design this home away from home at Westmead, where mums can stay with their newborns while they recover.
We know that transplants, when they go well, and they do 90% of the time, really are life-changing and life-saving for many, many people. That can only happen with the generosity of organ donors or families of organ donors.
Sok Tiang White. I'm a clinical nurse educator for Western Sydney Local Health District, and currently I am a cancer patient. The moment that I saw the doctor, I knew I was in really good hands. They assured me they would look after me. They have all been beautiful, and I've been very, very lucky. And I know that they are very experienced and knowledgeable people, and I put my trust in them. And I'm really grateful and thankful, and look where I am today. I'm still here and I'm around and still able to do my job as a clinical nurse educator.
So what's it really like to be a nurse? Today, Sydney reporter Sarah Stewart went to Westmead Hospital to find out.
I'm going to give you special medication through the mask, okay?
If you've ever been to hospital, you've met them, maybe held their hand, confided in them, possibly even cried together. But have you ever stopped and thought, what would it be like